Good evening. My topic for the day is daycare anesthesia. Let's begin and I'll start sharing my screen. Daycare anesthesia. Basically, overview of this lecture will be definition of daycare anesthesia, what are the goals of daycare anesthesia, how the daycare anesthesia is, conducted on the organizational level, how the patients are selected, that is patient selections, anesthesia management for daycare surgeries, and recovery, how we should decide about discharging the patients, and lastly, about the enhanced recovery after the surgery for fast tracking. So, definition of daycare anesthesia by British Association of for Day Surgery, that is BADS, as is a planned surgical procedure on carefully selected and prepared patients that are intended to be admitted and discharged on the same day in a specialized unit. So, it is sometimes also referred to as an ambulatory surgery, as the patient will be able to walk, in and out of the facility. So that's why it is also called as ambulatory surgery. So after the definitions, let's see what are the goals. What are the goals of daycare anesthesia? So or ambulatory anesthesia. Why daycare anesthesia is separate from a normal, conducted surgeries? Is like it will first of all decrease the healthcare cost because the patients are not admitted for 2 days, 7 days, and they will be just admitted and discharged on the same day or maybe on the next day. Patients will have a faster return to their function. They can join their duties. If they have to travel somewhere, and they can, immediately travel, and so there'll be better efficiency, or there is a lesser disruption in patient's routine. Also, unnecessary admissions which are there in hospital, maybe because of complications or non-availability of bed and then getting postponed. So these kind of things are avoided. So what are the factors which are popular for the daycare anesthesia and surgeries? As all these causes we saw, that there will be a lack of dependency on the availability of hospital beds. There will not be waiting of the patients because there is no bed. So that's why patient didn't get admitted, or there is no ICU bed. So there will be more flexibility of scheduling the surgeries. Also reducing the incidence of nosocomial infections because the patients are generally discharged on the same day or the next day. So there'll be shorter waiting list, there'll be overall procedural cost will be reduced, the higher volume of patients will be done because there are more and more cases will be done on the daycare level. It's because in a day the patient is getting admitted, and then there'll be a lot of waiting, and there will be lesser number of patients as compared to the daycare. Because of daycare level, we can have more and more patients because they'll be in and out faster of the patients. Recovery in a familiar environment. The patient will have a recovery in their familiar environment. This is especially true for the old patients. Nowadays, we are getting more and more elderly patients. They have a cognitive dysfunctions. Post-op delirium they can have. So, if they are in their familiar environment, all these complications will not be there. So, the recovery in a familiar environment is very important in old patients. Also, there is lesser procedural cost, so there is economical growth of the nation. So the daycare anesthesia or ambulatory anesthesia or ambulatory surgery, these are nowadays there is a concept in the US and in UK also, and in many other countries, that there are different models of these units. So there are hospital integrated models. That means there is a tertiary level hospital or a secondary hospital, and there are these daycare units or ambulatory surgery units. There is hospital dedicated model, means there is a hospital, because in hospital integrated model, what happens? Whatever staff is there, the surgeon who is there, he will have to share his responsibilities because he will have to do the routine list, and then he will have to do the daycare list because it's a hospital day. The staff will be, he has to share. So the duty list and the rotation will be in the same hospital. Well, the hospital dedicated model means a tertiary hospital is there, and attached to that there is one daycare unit or a ambulatory surgery unit is there. So there might be a different staff, a dedicated staff for the this daycare unit who is trained, and they are purely for that ambulatory surgery unit. There is freestanding but hospital connected, means there is a separate daycare anesthesia unit or separate ambulatory surgery unit, but it will be attached to some tertiary hospital. So if there is any complication, if ever we need any backup, so that tertiary level hospital will be always there. While freestanding and isolated will be the freestanding ambulatory surgery unit or a daycare surgery unit, and it will have all the facilities like if like a separate tertiary care hospital. It's a isolated only daycare anesthesia unit or the ambulatory surgery unit. So what are the office-based outpatient surgeries? Whatever daycare anesthesia or daycare surgeries, patient is coming in, surgery is done, and it is out on the same day or next day. So office based, it's like 9 to 5 office time, right? So office based outpatient surgeries are of three levels. So level one will be the surgeries which will be requiring minimal topical or local block or minimal oral sedations. Level two will be minor or major surgical procedures requiring oral or IV sedation with some of the dissociative anesthetic agents. That is level two. Like level one will be a topical block, will be a ring block surgery of a little finger. And level two, like minor or major surgical procedures like some fibroadenoma, which can be done with a sedation or Then level three will be requiring major conduction block, GA and deep sedation, wherein anesthetic supports the patient's bodily function. Something like pure TIVA or like a DNC, or where the patient has to be deep, or some hemorrhoid surgery. That's a level three, we can say. So, what are the prerequisites for the daycare, this proper surgery? It's first of all, whenever we are posting a patient for daycare, proper patient selection should be there. And whoever patient is there, there should be an optimized patient condition. That daycare surgery unit or ambulatory surgery unit should be well equipped center, and there is a efficient staff, the anesthetist, the staff who's looking after, who knows the discharge criteria and admission criteria, discharge criteria, because you have to immediately discharge one patient and take the next patient, something like that. So these are the prerequisites for the daycare unit. Now, what how we'll see what are the patient how the patients are selected for the daycare anesthesia. First of all, they will be depending upon the system level, surgery level, social level, and patient's comorbid condition. System level means whatever are the recommendations of your local, state, or the national regulatory organizations, which will influence your decision making. Like some of the centers have a less resources, they will have a different criteria of a daycare surgery. Surgical facility which is available also will influence the patient selection.